In this episode of Blood and Cancer News, we're highlighting studies from the 2020 San Antonio Breast Cancer Symposium, including a study on breast surgery's role in opioid use and research on pregnancy after breast cancer. And welcome to Blood and Cancer episode 125. This is the final B and C news of the year. Thank you so much for joining us this year, and we look forward to bringing you the latest in HemOnc news in 2021. We begin this episode with new research suggesting that even more women with breast cancer could choose to forego chemotherapy in the future. That's because adding chemotherapy to endocrine therapy did not improve outcomes for postmenopausal women with low-risk node-positive, HR-positive, HER2-negative breast cancer when compared to endocrine therapy alone. These are results from the large-scale Phase 3 RX-Ponder trial, which was presented at the meeting. For this study, researchers evaluated more than 5,000 women who had HR-positive, HER2-negative breast cancer and who had involvement of 1 to 3 lymph nodes. The patient's recurrence score was 25 or lower on a 21-gene assay. Study participants were randomly assigned to receive either standard chemo plus endocrine therapy or endocrine therapy alone. Over a median follow-up of 5.1 years, there were 447 observed invasive disease-free survival events, which is 54% of the expected number at final analysis. Across the whole cohort, adding chemotherapy to endocrine therapy was associated with a significant improvement in invasive disease-free survival, with a 5-year rate of 92.4% compared with 91% for endocrine therapy. Among the postmenopausal women, no such improvement was seen. The 5-year invasive disease-free survival was 91.6% with chemotherapy plus endocrine therapy and 91.9% with endocrine therapy alone. Among premenopausal women, there was an improvement in invasive disease-free survival. The 5-year rate was 94.2% with chemotherapy plus endocrine therapy and 89% for endocrine therapy alone. These differences were reflected in the results of overall survival. There was a non-significant difference in 5-year overall survival rates for postmenopausal women and a significant difference for premenopausal women. Stratifying patients by recurrence score, 0 to 13 versus 14 to 25, and by involvement of 1 versus 2 or 3 nodes did not have a major role on the impact or results.
Go beyond the headlines and hear the full story on Cleveland Clinic's Cancer Advances podcast. It's the medical professionals' trusted source for exploring the latest innovative research and clinical breakthroughs happening in the field of oncology. From the highest profile cancer trials conducted at our research facilities to understanding how they impact your patients, Cleveland Clinic's world-renowned experts take a deeper look. Listen to the latest Cancer Advances episode by visiting clevelandclinic.org/Cancer Advances podcast.
More than 1 in 8 women who undergo mastectomy with reconstruction for breast cancer treatment or prophylaxis become persistent users of controlled substances thereafter. This is according to data from a retrospective cohort study also presented at the 2020 San Antonio Breast Cancer Symposium. In the study, the researchers analyzed data from more than 25,000 women who were not prior users of opioids and more than 27,000 women who were not prior users of sedative hypnotics. Women were considered new persistent substance users if they had no use of opioids or sedative hypnotics in the preoperative period, but filled at least 1 prescription in the perioperative period and at least 2 in the postoperative period. The researchers reported that overall 13% of opioid-naive patients became persistent opioid users, and that 6.6% of sedative hypnotic naive patients became persistent sedative hypnotic users after their mastectomy and reconstruction. Proportions of substances used were even higher at 17.5% for opioids and 17% for sedative hypnotics after excluding women who did not receive or fill a perioperative prescription. In multivariate analysis, patients were significantly more likely to become new persistent users of opioids or sedative hypnotics if they had Medicaid insurance, had a breast cancer diagnosis versus a prophylactic indication, received chemotherapy, and were 50 to 64 years old or 49 years old or younger, compared with those 65 years old or older. Finally, patients' likelihood of new persistent substance use increased with their number of risk factors. For persistent opioid use, the odds ratio rose from 2.27 in patients with 2 risk factors to 6.34 in those with 5 risk factors. For persistent sedative hypnotic use, the odds ratio rose from 2.55 to 7.71. And our final breast cancer story of the year. Breast cancer survivors are less likely to get pregnant and have higher risks of some delivery and fetal complications. However, pregnancy does not increase the risk of cancer recurrence. This is according to a meta-analysis that was reported at the San Antonio Breast Cancer Symposium. The researchers used data from 39 studies that included more than 114,000 breast cancer patients and more than 8 million women from the general population. Results showed that breast cancer survivors were much less likely than women in the general population to become pregnant. The relative risk was 0.40. That said, the majority of studies in the meta-analysis did not capture information about how many women tried to get pregnant. That was pointed out by Dr. Matteo Lambertini, who's with the University of Genova in Italy. He presented the study at the meeting. Dr. Lambertini said that returning to a normal life after cancer diagnosis and treatment should be considered in the 21st century as a crucial ambition of cancer care. In patients who are diagnosed during their reproductive years, this includes the possibility to complete their family planning. Due to the rise in age at first pregnancy in recent years, many women are diagnosed with breast cancer before completing their reproductive plans. Dr. Lambertini and his colleagues found that among women who became pregnant in the study, breast cancer survivors did not have higher odds of spontaneous abortion or complications such as preeclampsia, and their infants were not significantly more likely to have congenital abnormalities. However, the breast cancer survivor group did have higher odds of cesarean birth, low birth weight, preterm birth, and infants small for gestational age. In a stratified analysis, the higher risk of having an infant with low birth weight was significant only for women who had received chemotherapy, and the higher risk of having an infant who was small for gestational age was significant only for women who had received chemo or for women who had a late pregnancy. That's 2 to 5 years after cancer diagnosis. Among breast cancer survivors, those who became pregnant actually had lower risk of disease-free survival events and a lower risk of death. Findings were similar in the subset of studies that adjusted for the so-called healthy mother effect. The researchers found that pregnancy did not significantly affect disease-free survival among women with hormone receptor-positive disease and appeared protective among women with hormone receptor-negative disease. Pregnancy also appeared safe in terms of overall survival, irrespective of survivors' BRCA status, nodal status, receipt of chemotherapy, pregnancy outcome versus completed versus abortion, and pregnancy interval. And that's it for this final edition of Blood and Cancer News for the year 2020. We hope you'll join us in 2021 for the latest in hematology and oncology. Blood and Cancer is produced by MDedge editor Jennifer Smith and MDedge executive editor Kathy Skarback.